It's lovely to see you all. And thank you so much again for coming on this Thursday lunchtime. It's absolutely brilliant. And I really hope that this is going to be loads of value to you and that you're going to really enjoy it and pick up some useful information. For anyone who doesn't know me, I'm Dr. Lisa. I'm a GP, I'm a lifestyle and obesity doctor, and I specialise in helping men transform their health. This is really for men who feel a bit out of control with their health and they want help transforming so that they can go back to sort of feeling like that their old selves. Our theme for August coming up is physical activity. So today we're going to be talking all about physical activity, all the things that you can do that can help with your health. And then I'm going to talk to you about the recent guidelines that have come out from the chief medical officers from the UK. So that's for sort of England, Scotland, Wales, Ireland, and Northern Ireland. And they've got some brilliant guidelines, all evidence-based, telling us what we can do to improve our health in terms of physical activity. And then I have a recording. So unfortunately, Dr. Kelly Blaze couldn't be with us in person today because of, unfortunately, family logistics. But we did a really good recording on Tuesday. We got loads of information. I've cut that down to about 15 minutes. If you want to watch the whole video, I'll be putting it on YouTube. But just for today, I've cut it down to 15 minutes so we can look at I asked her lots of questions about how men can maintain their physical and athletic performance as they age. So that should be really interesting. So just before we start, I just make sure that everyone just has their microphones muted during the talk. We'll have questions at the end. Anything you want to say, put in the chat box. This session is being recorded, so I hope that's okay with everybody. What I will do is I will stop the recording or I will delete anything where we have questions, just so that you can it can be anonymous because people would probably maybe prefer it to be anonymous when they're talking. If you want to stay anonymous, you can always change your name on the Zoom just so that it doesn't show up on the screen in the recording. Okay, so let me just go to share my screen. So this is a talk about the new physical guidelines that have come out by the chief medical officers of the UK. And they were published, these are hot off the press. They were published on the 10th of July. What we need to do is we have all these recommendations, or you should be doing this, you should be doing that. But what we want to know is the information that we're given, is it actually evidence-based? We don't want to be doing things that aren't necessarily evidence-based. We want to make sure that what we do is actually going to improve our health. Okay, so basically, in a nutshell, the guidelines show that any sort of physical activity will improve your physical and mental health, and that is for men and women, all ages, children, adults, and people who are in their older age. And this phrase that was coined by the Medical Royal Colleges in 2015, and actually I saw yesterday that Chris Hoy actually quoted it when he was talking about how physical health activity has helped him with his prostate cancer. So the quote is, "If physical activity were a drug, we would refer to it as a miracle cure, because the number of illnesses that it can prevent and it can treat." So if you could wrap up physical activity and make it a drug, it would be a miracle drug. Basically, and the gist of it is that adults should aim to be physically active every day. Any activity is better than none, and more is better even still. So that's basically it in a nutshell. Okay, so when we say that physical activity improves your health, let's just look at what it actually does prevent. So being physically active can reduce your chance of having type 2 diabetes. It can reduce your risk of cardiovascular disease. It can reduce your risk of having falls and it can reduce your risk of mental health problems like having depression. It can reduce your risk of joint and back pain and reduce your risk of certain cancers. But as well as that, having physical activity will help you to sleep better. It helps you with stress. It helps you to maintain a healthy weight. We'll talk a bit more about that later. It improves your quality of life. It reduces your risk of social isolation. And we talked about that last month, about all the health benefits of not being socially isolated. And as well as that, it improves your performance at work. So lots of evidence-based statistics showing that physical activity does actually improve our health. What do we mean by physical activity? Well, the definition is any sort of body movement that's produced by your muscles that requires you to use energy. So when we're talking about it, we're talking about cardiovascular, so that's anything that's going to make you increase your breathing rate, that's going to increase your pulse, make your muscles work harder. We're talking about also strength training, and and that can be sort of resistance training, and the sorts of strength training also that's really important is weight bearing exercises that can then help improve your bone strength. Also, so cardiovascular is very important, strength training is very important, but also balance is also really important, especially as you get older, because that helps reduce your risk of falls, and also flexibility. So the better flexibility you have, the less risk you have of injuries. What sort of physical activity are we talking about? Well, it doesn't matter what you do. In order for it to be a lasting change, it's really good if it's something that you enjoy. So it could be walking, it could be cycling, it could be wheeling, it could be doing any sort of sport, dancing, running, going up the stairs, gardening, anything that uses your muscles, that burns up some energy. And if you're not used to doing much exercise or physical activity, then just taking the stairs rather than the lift will help. Or, parking your car far away in the car park, so you have to walk rather than just parking as close as you can. And then, you're not doing much walking. And it's sort of making this physical activity part of your life. So it's not about, joining a gym. It's just about trying to build active movement into your everyday life. And by the way, today is actual cycle to work day. So it sort of coincides nicely with this. So, using active travel. So think about, okay, is there a way I can get to work which doesn't require me just parking right outside my work? Maybe I could park a bit further away and walk, or I could cycle to work, that sort of thing. Now I live in I sort of South Manchester, and I work in the centre of Manchester. I'm not sure cycling in might not be the best idea, because unfortunately the roads maybe aren't geared up to it, but it may be something we could look at possibly in the future. Okay, so how much exercise do we need to be doing? So this graph basically shows you that the recommendations are that, and all the evidence shows. So basically the magic number is 150 minutes a week. So that's basically 2.5 hours. So that's the recommendation. So for the maximum health benefits, 50 minutes is the magic number. But can you see that if you do nothing and you just do a little bit, then you can see that you're getting health benefits. You can see, because on this line is being inactive to very active, and these are the health benefits. So you can see that even just doing a little bit, so even less than 150 minutes, you are going to get health benefits. And you can actually see that going from being inactive to up to 150 minutes a week, the health benefit improvement is huge. And it's only after 150 minutes. Yes, there are benefits, but they're not obviously as dramatic. The changes aren't as dramatic as they are if you're going from inactive to 150 minutes a week. So basically, what it's saying is that do anything, any sort of physical activity is going to give you health benefits. But obviously, the more you do, the better. So if you're not doing anything at the moment, even 10 minutes would be, or even 5 minutes, anything you do is better than nothing. So that's basically the evidence to show, and the highest, where the graph is at its steepest, is actually at 100 minutes. So around here, which is showing, that at this point is where you're going to get the biggest change in health benefits. Okay, let's go into that a little bit more. Let's talk about those numbers a bit more. So basically, if you're doing moderate activity, now moderate activity is where you can talk, but you can't necessarily sing. So you could be walking briskly, you can be chatting to your mate, but you probably couldn't sing a song because you're too out of breath. So that's moderate activity. So we should be getting 150 minutes of that a week. So that could be five, 30-minute walks, for example. So, or if you're doing vigorous activity, so this is activity where you can't speak, then you need 75 minutes of that. And if it's very vigorous, like you're running up the stairs or you're sprinting, then actually that can be less than 75 minutes. So depending on how vigorous your activity is, it will determine how many minutes of that sort of activity you need in a week. If you do less than moderate, that is also fine, but you just need to do more of it. The recommendations is, but as well as getting this physical activity, we also need to be doing strength training. So, and the recommendations are that we should be doing 2 lots of strength training a week, and that should be our whole body, so upper body and lower body. But also, it's very important to be doing balance training, because that is going to prevent us from falling over and injuring ourselves as we get older. Okay, so any movement counts. So in the day, it used to say sort of 10 minutes, but now it's like any single movement. If it's just standing up out of your chair, if it's only just walking around the house, any sort of movement, it helps. And actually, although it says you need 150 minutes a week, you could actually do that on 2 days of the week. That's also, you would get the same health benefits, although it's probably better to be getting physical activity every single day. As I said, light activity can match moderate, but you have to do it for longer. And there's lots of evidence to show that the more physical activity you do, the fewer admissions there are to hospital, the fewer prescriptions you need, the less medication you're going to rely on. And in England, 1 in 4 adults do less than 30 minutes of physical activity a week, which is quite shocking. Okay, so strength training is really, as I said, it's really important, because as you get older, you lose muscle mass. You also lose bone density. So it's really important that we build these into our routine. You need physical impact. So swimming and cycling are great, but actually you need to be doing weight bearing exercise for your bones. So walking, running, jumping, that sort of thing, that helps your bone health. And we were saying the importance of balance, because that actually affects your cognitive decline as you get older. So your risk of dementia, etc. Okay, so we've talked about the health benefits of physical activity. So it's really important we're physically active, but something quite separate to this is that it is harmful to be sedentary. So sitting is harmful. Basically, you could go to the gym. Yeah, at that point, we should all stand up, because we've been sitting for a few minutes. So a lot of us will have desk jobs where we're sitting at our desk all day. Now, if you sit at your desk all day and then go to the gym in the evening, that does not negate what you've done by sitting down all day. So it's not advisable to sit at your desk for 8 hours and then go to the gym, because what you do in the gym doesn't mitigate for the hours you spent sitting down all throughout the day. So sitting is harmful. And so what would be recommended is that during the day you're standing up at regular intervals. We're not exactly sure what those intervals should be, but I think generally a consensus would be, say, 30 minutes. So every set, you might want to set your alarm, you might want to just build it into your day. So what we do is we go and walk into the waiting room and collect our patients. So every 10 minutes, we're getting up, we're going into the waiting room, we're calling our patients into us. So making sure that we're getting up. So we're not, so we're not sitting for 4 hours during a clinic. We're getting up and go and make yourself coffee, go to the loo, go and do a lap of of your workplace, go and talk to a colleague. It's just really important that you move and you're not sitting for hours. And as it says here, sitting time is associated with the increase in your all-cause mortality. So death from any cause, it increases your cancer risk, increases your cardiovascular risk, and it reduces sort of survivorship from cancer. So it's really important. Not only are we getting physical activity, but we're not sitting around all day. Okay, now the thing about diet. So we're talking about obesity, we're talking about weight loss. Now, physical activity does not make you lose weight. Diet makes you lose, changing your diet makes you lose weight. Now, physical activity can be important for maybe maintaining your weight loss. And obviously, it is really important for your general health. But if you're looking to lose weight, physical activity isn't going to do that. It's your change in your diet that really is going to do that. So, we said you can't out train your chair. You also can't out train your diet, because probably also going to the gym, burning off energy makes you more hungry. So physical activity is really important for all your health. But actually, if you're looking to lose weight, you need to focus more on your diet. And then weight loss injections. So this is for the first time, this has been brought into the guidelines. When you're on weight loss injections, you lose both fat and muscle. So it's really important that you're doing strength work to maintain your muscle mass. The guidelines for the weight loss medications say that they're only licensed in conjunction with physical activity and other behavioral changes. So we can't just rely on taking the jabs. We need to be doing physical activity as well. But often you find, as probably Pete spoke about last time, is that once you've lost a bit of weight, then suddenly you do want to build muscle, you do want to go to the gym, because it kind of it helps just break that cycle and gives you more energy. Okay, so basically, don't put it off. So let's all try and increase our physical activity. If we're not doing any, let's try and do some. And if we're doing some, let's try and do a bit more. And let's not make excuses. So the evidence shows that physical activity will not harm you. So sometimes, especially as you get older, people are worried, oh, I might injure myself, I might pull something, I might hurt myself, oh, I might have a heart attack while I'm doing it. Well, the evidence shows that is not going to happen. So, you're not going to injure yourself. But what's really important is that you build it up slowly, so that you don't just suddenly go from doing nothing to doing something where you will injure yourself. You need to just gradually build it really more slowly. And Dr. Kelly talks about that a bit later on in her talk. And it's never too late. It's never too late, because look at the graph that we showed. From doing nothing to doing a little bit gives you the health benefits. So it's never too late to start. If you are worried about doing a bit of physical activity, maybe get some advice from a personal trainer. Maybe a personal trainer will help you, make sure that you're not overdoing it. Obviously if you can afford it, but it's good to get specialist advice. But literally just, from doing nothing to doing something, even if it's just walking down the road, building it up gradually, not injuring yourself, it's going to give you huge health benefits. Okay, so this is basically the guidelines for adults this is my adaptation because I haven't included children in this, but the health benefits across your adult life of doing physical activity, it will help with your mental health, it will help your fitness, it will help with your weight management, it will help with your muscle and bone strength, it will help with sleep, it reduces your risk of having a stroke, heart disease, type 2 diabetes, cancer. It prevents joint and back pain, it helps with blood pressure, it helps with stress. Even if you have a disability or a long-term condition, it will help with your maintaining your independence, it will improve your quality of life, it will improve your physical function so that you can do the things of day-to-day living. It will reduce your risk of falls and it helps your brain health. So if you're worried about dementia, etc., it will help with that. Okay, so that's the end of my talk. Just do something and don't put it off. Okay, well, that leads nicely on to, so I think Dr. Kelly Blaze, so she, unfortunately, as I said before, that she couldn't make it today. I was hoping she would be able to come and join us, but unfortunately, because of her family commitment, she couldn't. But I had a really good conversation with her on Tuesday. So, and I'd love to be able to, I'm just going to show you that recording if you don't mind. We've cut it down a bit to try and keep it in within the time. So I'll just tell you a bit about her. So Dr. Kelly Blaze is a GP. She's a sports and exercise medicine doctor. So, and she's a GP with a special interest in musculoskeletal medicine. She does joint injections. She looks after people with musculoskeletal injuries. She also works with the Worcester Warriors Rugby Club. They're a championship rugby team. She looks after the players. She looks after them on match day. She's rugby mad. She's married to an ex-professional rugby player. She used to work for the Leicester Tigers, who were a Premiership club. Not only that, she is the founder of her own business, which is actually for females, called the Female High Performance Code, and she's a coach and she helps women in sport to improve their leadership and performance, and she's helping with sort of changing the shape of future of sports. She does monthly workshops, that's for women, but because of her expertise in rugby and in men's sport, I thought she would be great to get her advice on things. Okay, so hopefully you can see that. And how do you think that as you get a bit older, that men can maintain sort of their strength, their power, and their muscle? Could you give them any advice about?
So I think the biggest thing we need to remember is that, have you ever heard of the concept of sarcopenia?
Yes, yeah. So we just explain what that is.
Sarcopenia is the gradual loss of muscle mass as we get older. And we typically lose from the age of about 30, mid-30s onwards, we're typically losing between 3 and 8% of our muscle mass during that time yearly. Okay.
Yeah.
And as we do that, we are, as a man, your muscle declines, your testosterone declines, your metabolism slows, your insulin resistance worsens, and you're likely to put on weight. And so the best thing that men can do in order to maintain not just, physical health, but also athletic performance. There's quite a lot of men that will carry on playing sport until very old. We've got a man that I used to look at during my sports medicine clinic who was in the Vets England football team. There's lots of men that carry on doing marathons until their late 80s, So it can be done and you can keep up with sport, but it is about muscle mass and it's about maintaining your muscle mass. And in order to do that, I think the biggest advice that I would give men is that you need to make sure you're eating and eat the majority of your protein in the morning, then actually you're stabilizing your blood sugars for the rest of the day. So I would say max out on the amount of protein that you need, make sure you calculate it right, get the amount of protein that you need in, and then make sure that it's the beginning part of the day, because that will keep your insulin levels low. So then you're not reaching for snacks, you're not wanting to eat. If you eat all your carbs in the morning, you're going to be starving for the rest of the day. So, so I would say protein is massive. The other thing that I think is massive is probably creatine.
Yeah.
Creatine, obviously, you know, is one of the, research supplements that actually does improve muscle mass. And so I would say that taking creatine is a non-negotiable as you get older. I take creatine, I would encourage men to take creatine. And then strength training, and, strength training, probably about 2 or 3 times a week. You have men that, are so drilled into them that, cardio, and they like the adrenaline rush and the buzz of like hitting the, spin class or the hit class or what have you. And they don't feel like they've done anything unless they're in buckets of sweat. But, and it is good, we do need to maintain our VO2 max. And that is something that helps cardiovascularly with aging. It helps with weight loss and all of those things. 3 times a week, roughly, on the strength training and increasing that strength up so you're loading progressively. I think one of the worst things that I see, so working in sports medicine clinics, you obviously get a lot of people that are injured. They've got a rotator cuff issue. They've come in, they've pulled their Achilles. And typically men around a certain age, between 40 and 50.
Yeah.
And, that I'll take the history, so how has this happened kind of thing. And it was like, it's classic. It's kind of like, I wasn't doing much exercise. I hadn't done any for the last 4 or 5 years. Life had got busy. And then I decided that I was going to run a marathon, this massive load, where they'd never done anything before. They just go hell for leather. I haven't done anything for 5 years, but I saw it on the telly and I thought I'd give it a go. And I go, oh, right, okay, that's probably not the way to go at it. So the majority of injuries that I see in men between that 40 to 50 is a long layoff of I haven't done anything. I have been a few times. To I'm gonna run the marathon. I'm going back to tennis, and I'm gonna do the amount of training that I used to do like 15 years ago. It's that increasing load massively and loading. So the thing that I would say is strength train is definitely what you should do. Automatically think that you can still lift the weights that you did in your 20s if you haven't done anything for 5 years. Start small and progressively move up. Learn slowly, because otherwise you are going to, you're going to injure yourself. So that's one thing that I do see quite a lot in sports medicine clinics.
That's really important.
Definitely the runners.
Yeah. Oh, really? Yeah.
They don't think about the footwear. They don't think the fact that they've lost quad strength, they've lost hamstring strength. They just go, oh, I can do 10K. I haven't done anything for 5 years, but I can do 10K. And then they end up in my clinic. So what I would say is I am all for starting up a new exercise routine, and I'm all for getting to 10K, but please do it progressively. Please load. Please realise that if you're going to run, you also need to strengthen the muscles. You need to strength train alongside the running and progressively do it, and that would reduce your injury rate. There's other things as well, like what I call beach weights. So there are certain exercises that men will do in order to look good, beach body ready. So they'll do loads of bicep curl, they'll do loads of, bar press, everything. But will they stabilize the core and do their back muscles? No, probably not. And so what will happen is then their pec muscles and their shoulders will round down because they're not doing enough back to keep them out. And they're overdoing the pecs and they're overdoing the biceps. And then they get rotator cuff issues. So remember that your shoulder is functioning joints, and it needs the whole of the rotator cuff worked, not just the muscles that are going to give you good pecs and good biceps. So I do see that a lot in people who like to weight train and who like to weight train for aesthetic reasons, like bodybuilders, those sorts of people, is that they tend to get injuries because they are doing it for a certain aesthetic look rather than the functionality of their shoulder.
Any other supplements that are useful, do you think, for people to take?
I think for me, that there's only worth in a supplement if you're deficient in that particular area. So I think going to your doctor and actually getting a baseline set of bloods, quite a lot fatigued all the time or low all the time. Men don't typically suffer with iron, but they can suffer with vitamin B12, those sorts of issues. I think vitamin D is always a good thing to take.
Yeah.
Indeed, bone supplementation is fantastic, and calcium. But I think I do recommend going to, rather just taking blanket amounts of supplements and rattling all day. Creatine is a proven thing that's going to help with your muscle mass. But if you do, what my thought process would be, go to the doctor, find out what you're deficient in, and then go from there. There's a big trend at the moment. I think when the menopause came in for women, there seems to be a trend now towards testosterone for men and looking more deeply into whether or not you're testosterone deficient and what have you. And if you do get any of those symptoms of testosterone, low testosterone, seek medical advice, absolutely. But there's a lot of supplementation on the market for testosterone these days. When I look at it, there was one I saw that was called shilling. And basically what it seems to be doing is giving people the substrates that they need in order to make testosterone. Because obviously you need a lot of different types of ions, don't you, to make testosterone. And so if you do feel like you are low in those sorts of things, I think there's no harm in it. But I don't know that there's any clinical evidence or research in it unless and if you're low testosterone, that should be diagnosed by a doctor and should be followed up by an endocrinologist. It's not going to be made better by some supplementation that you get on. Yeah. The other one that I think would be quite useful for somebody who is training quite regularly is magnesium, and it helps with overall it can help with resetting the muscle fibers. It can help with reducing muscle cramps. And so overall, especially if you're going to be training, you're going to get a certain amount of DOMs, then magnesium is really, really good. It helps with your sleep as well. Yeah. And you just mentioned something called DOMs. Can you just explain what that is? So that's your delayed onset of muscle sore from your desk, those sorts of things that generally feels like that's usually progress. Yeah. Okay, brilliant. And in terms of, so sort of going on from that then, so say if you have been to the gym, you've worked really hard, what would you recommend for sort of recovery from doing that sort of thing? So, honestly, there's so many things that some of the boys engage in now with regards to recovery. Yeah. General old-fashioned rest. Yeah. We've got boys that use cryotherapy. So, cold baths, 20 minutes to, the cryotherapy is supposed to reduce the inflammation within the muscles, and that can help with recovery. Obviously, all your supplementation, all of your drinking, all of your protein, and that refueling during rest. You've got like a sports physio or a sports rehabber, which we have in the club. We use massage and sports massage afterwards to help and aid their recovery. The other thing that I would say is massive for recovery and injury prevention is yoga. Yes. So stretching is really, really important. Yeah. I can't tell you the amount of injuries that I get in players because they have tight hamstrings. And their range of motion is awful because they're stiff as a board, because they have so much eccentric contraction that they are building and building muscle strength, but they're not doing the eccentric contraction that gives that lengthening to the muscle. So just brave it. Don't be afraid to be the man that can't lift his arms up and, go all the time. And you've got the men who will brave it and they'll go there and, yes, they're stiff, but they're doing it. Guy. If you want to recover well, if you want to maintain performance, if you want to reduce your risk of injury, stiffness is the enemy. Yeah. And I think it's such a shame that yoga's got this sort of female sort of connotation, both and lots of high performance. Lots of athletes do it. So it's those types of athletes that we have to work on to keep their hamstring strength, but also maintain that mobility. Swimming is something that we do all the time for rehab and recovery in rugby. A lot of the time we have players that have got lower limb injuries. And so in order to keep their muscle strength without actually putting large amounts of weights through the muscle, we use swimming a lot of the time. And that's a really good way of flushing out the muscles and actually restoring the biochemistry within somebody's muscle so that then they can go and do their strength training again, is getting the ball and just, it literally sometimes it's just about holding the side of the pool and doing not breaststroke, but front crawl legs, just to flush the muscles out under minimum tension so that then they can recover and go back more load-based.
And the other thing that you mentioned that we didn't sort of go, it was like course.
Yeah, course of
Yeah. Yes, you said how important that is.
Yeah, definitely very, very important. And I think, you know, if you're going to do any sort of activity, any sort of athletic activity, depending on, you know, what you want to do, whether it's going back to rugby, whether it's going back to golf, I think a lot of us, and this is where I see go down the drain, is that a lot of us these days, we work as a desk, don't we?
Yeah, we do.
So where everybody's like this, and
so just to recap then, the sorts of things to maintain strength, power, and muscle. Obviously, you were saying that we're doing strength training 2 or 3 times a week.
Yeah, strength and power training. So the combination that we would use in order to, and then power is sometimes equally as important in order to prevent injury. So we will do power training would be something like your medicine ball throws. Power training would be something like jumping onto a box, jumping off a box, that explosive power. That's quite important to us in rugby, but it is also important generally in strength training to make sure you've got, you know, an equal amount of power and strength. I think that the way to look at it for me is that quite a lot of the mindset sometimes is around exercise, is about sort of a weight gain and, you know, but really we need to be thinking about the quality of our lives and how long we want to stay physically and mentally strong. If I know anything from general practice, it's that how much quality of life you want to be. You don't want to just be happy, you want to be thriving. And it is possible. You know, there are, like I said, I've got that football player who's in the England vets, loving his life, playing the best football, he's there for me. You've got men that are doing marathons into their 60s. Have fun with that.
Okay, so we'll leave it there. So I think she was just going on after that to talk about that it's all about quality of life and it's not about how long you live. It's sort of what your healthy years are, how many years of good health that you have. So just to recap then, I think the main points that she was making was that it's really important to get enough protein. Now, we didn't talk about the exact amounts, but that could be something, well, the recommendations are possibly 1 gram per kilo per day, maybe up to 1.5 grams per kilo. Now, if you're an athlete and you're doing sports, maybe you could go higher, but generally around about between 1 and 1.5 grams per kilo. Creatine is really good for building muscle and also for cognitive function, your brain function, strength training. Now, I said the recommendations are 2 times a week. I think she's talking about in athletes 2 to 3 times a week plus power training, building it up slowly so you don't injure yourself. Supplements, take if you're deficient in that certain supplement like B12 or iron, but good ones to take anyway might be vitamin D, calcium, magnesium. Testosterone is a whole different topic. We maybe do that one another day. Basically saying only take testosterone if you're medically being diagnosed with testosterone deficiency. Yoga and stretching, really important. Swimming's good when you're injured. Obviously, it's not a weight-bearing exercise, but it's great for overall body exercise. Having a strong core is really important, and it's about quality of life.